Let's start with puerperal psychosis and postpartum depression. I have tried to make this puerperal psychosis and postpartum depression together because some things are similar. So whatever is in red is about postpartum depression and blue is puerperal psychosis. First we'll see puerperal psychosis. Puerperal psychosis is definition is severe acute psychiatric illness occurring within 2 to 4 weeks after childbirth. Okay. Onset is within 2 to 14 days after childbirth. Risk factors: previous bipolar or schizoaffective disorders, past puerperal psychosis, family history of mood disorders, sleep deprivation, obstetric complications, endocrine and hormonal changes. And same risk factors will be applicable for postpartum depression also. So, what are the features of puerperal sepsis? Sudden onset of confusion and disorientation, severe mood symptoms like mania, depression, and mixed features, delusion related to baby, hallucinations, marked anxiety, agitation, and irritability, disturbed sleep, poor bonding with infant, and a risk of suicide and infanticide. So, this is the clinical features of puerperal sepsis. And management is urgent hospitalization, mood stabilizers, antipsychotics, benzodiazepines for agitation, and ECT can be done in severe or life-threatening cases. ECT is electroconvulsive therapy. So this was about puerperal psychosis. Whereas on the other side, that postpartum depression, it is rare, and the onset of this postpartum depression is 2 to 6 weeks after postpartum. Okay, it is more common. What is more common? This previous or schizoaffective disorders are more common risk factors in postpartum depression. Okay, so we'll see the difference. Puerperal psychosis onset was within 2 to 14 days, but in postpartum depression it was 2 to 6 weeks. Okay, now the risk factors are almost same. Okay, in clinical features, the extra things are that here there will be intact orientation and intact consciousness. Okay, postpartum depression, here they will be having intact orientation and intact consciousness. They will be having depressed mood, anhedonia, guilt and hopelessness, but this delusion related to baby and hallucination is absent in postpartum depression. Okay, there will be persistent sadness, cry, okay, crying spells, and here also we'll have disturbed sleep and poor bonding with infant, but the risk of suicide and infanticide is low. So this was about postpartum depression. How to diagnose postpartum depression? The symptoms of major depressive episode beginning in the postpartum period, and that is lasting for more than 2 weeks. This is not due to medical illness or substance abuse. Okay, so there should be major depressive disorder lasting for more than 2 weeks, and there should be no medical illness or substance abuse, and this will cause significant distress or impairment. Okay, so this was about the postpartum depression, that it is a depressive disorder with persistent low mood and functional impairment. Okay, now what things are remaining? Management is mild to moderate. We have to go for psychoeducation and reassurance. For moderate to severe cases, we can use SSRIs, that is sertraline and fluoxetine, and we can consider baby friendly safety. Okay, then consider family support and follow up. In severe cases, we can go for hospitalization and ECT. There is a FDA approved drug known as brexanolone, and zuranolone. These are FDA approved drugs for postpartum depression. Okay, so I have made almost a differences between these two. Okay, so whatever is in red is postpartum depression and blue is puerperal psychosis. Almost same things are there, but this postpartum depression will have these things less, like intact orientation, consciousness, and low risk of suicide and infanticide. Thank you so much.